I'd like to request the next speaker, Dr. Pooja Sinha, who will be speaking on retinal evaluation before premium IOL implantation. Dr. Pooja Sinha is a senior VR surgeon at ABI Institute, Patna.
Good morning, everyone. I'm thankful to AIOS and Dr. Satyajit Sinha for this opportunity. So I'll be speaking on retinal evaluation before premium IOL implantation. As a retina expert, I advocate a thorough and complete fundus examination for all patients undergoing cataract surgery, let alone premium IOLs. But then again, with premium IOLs, as has been discussed, the stakes are high, a lot of cost is involved, and the patient's expectations are also high. Structures to be assessed are media, the optic disc, macula, retinal blood vessels, and general background. This is an important point. A posterior vitreous detachment has to be explained to the patient, because many a times after a very good cataract surgery with 6/6 vision and a good IOL implantation, the patient is very unhappy because he says that I see some floaters which are moving in front of my eye, which was not there before cataract surgery. So that can be explained because sometimes the lenticular opacity is so significant that the floaters are not appreciated. So in my practice, I write PVD, and in bracket I write explained, so that in future I remember that I have already told this to the patient. So fundus examination is important to prevent post-op complications. Cataract surgery, while generally safe, can sometimes lead to retinal complications like retinal detachment or a cystoid macular edema. Identifying pre-existing conditions allows for proactive management and potentially reduces the risk of these complications. Optimizing surgical planning. Certain retinal conditions might necessitate a modified surgical approach or even delay in surgery until the retinal condition is addressed, like so many disorders like diabetic retinopathy and so on. Ensuring best visual outcome. A healthy retina is crucial for achieving optimal visual outcomes after cataract surgery. Identifying and treating any underlying retinal issues before surgery can improve the chances of achieving the best possible vision. So how do we perform a retinal evaluation? So, first and foremost, a dilated fundus examination. This is a standard method where pupils are dilated with drops to allow a detailed view of the retina using an ophthalmoscope or a slit lamp. An OCT, this is a very, very important diagnostic tool. It is a non-invasive image technique that provides high-resolution cross-sectional images of the retina, allowing for detailed assessment of retinal layers and any abnormalities. Fundus fluorescein angiography sometimes has to be done. This involves injecting a dye into the bloodstream and using a special camera to visualize blood vessels in the retina, helping to identify conditions like diabetic retinopathy or a retinal vein occlusion. Ultrasound. If the view of the retina is obscured by a dense cataract, which is many times the case, an ultrasound imaging can be used to assess the retina. And then an A scan is also a type of measurement to measure the length of the eyeball, which is needed to calculate the correct power of the intraocular lens implanted during cataract surgery. So what do we look for when we do a retinal evaluation? The first and foremost, which definitely cannot be missed, is a retinal detachment, especially if there's just a peripheral pocket of fluid which can cause subsequent vision loss. Diabetic retinopathy, because many patients are diabetics and they come with the notion that when they see less, it is because of the cataract and nothing beyond that. And we have to explain to the patient that diabetic retinopathy, which involves the retina and the macula, can cause obscuration of the vision. A retinal vein occlusion is the blockage of the retinal vein, which could be central or it could be a branch. Macular degeneration, in age-related macular degeneration especially, damages the macula, the central part of the vision, which can cause vision loss and of course spoil a very well done cataract surgery. Cystoid macular edema is the swelling of the macula which can occur after cataract surgery and can be influenced by pre-existing retinal conditions. And any other retinal conditions like retinal holes, tears, hemorrhages, especially peripheral retinal holes in myopic patients, atrophic holes, large lattices with holes have to be addressed before the cataract surgery, because after cataract surgery, when the IOL is implanted, believe me, it is very difficult to do peripheral lattices because of the edge glare. So lattice has to be tackled before the cataract surgery. And foremost is patient education. Before cataract surgery, patients should be educated about the importance of retinal evaluation, potential risks and expected outcomes. So this is just for completion. Projection of light is sometimes used for retinal evaluation, which is important. And then you have the two light discrimination test for spatial or temporal differentiation, entoptic visualization, which is nothing but perceiving floaters or any opacities inside the fundus or inside the vitreous humor. And then ultrasound I have already explained. When the media opacity is very significant, then we do a B scan. So these are just some OCT images which I had have captured, which were very subtle and could have been easily missed if we had not done an OCT. So in this picture you can see that there is posterior bowing of the outer retinal layers, and this can cause subtle abnormalities in how the patient perceives after cataract surgery. This is a very dense retinal lenticular haze which obscured the retinal findings, and when we did an OCT, I was surprised to see such a massive amount of intraretinal inflammation and fluid, which was immediately tackled before we underwent cataract surgery. So this is another case. You can see the subtle vitreomacular adhesion, which has to be very clearly explained to the patient and shown to the patient, because this vitreomacular adhesion can lead to a vitreomacular attraction, causing subsequent decrease in vision post cataract surgery. So this is a very important slide. I advocate OCT as a must for all the cases before cataract surgery, especially when we are putting premium IOLs. And I would say not only premium IOLs, any kind of retinal surgeries, an OCT is a must nowadays. It is a must pre-operative assessment before phaco surgery, because it helps to pick up subtle macular abnormalities. As I have already explained, patient expectations are especially high when premium IOLs are implanted. So OCT is a must in all cases, and we do that as a routine in all cases undergoing cataract surgery at our center. Except in hard cataracts and poor retinal visualization, OCT has to be performed in all cases. And in such cases, one should explain to the patient that once your cataract surgery is done, we are doing a B scan now, but once your cataract surgery is done and an IOL is in place, we will do a post-operative OCT evaluation to just complete everything in our armamentarium. Thank you so much for your patient hearing.
Thank you so much for the wonderful presentation, Dr.